Now it is my pleasure to introduce Dr. Ellen Carlin. She currently serves as a Senior Health Policy Specialist at EcoHealth Alliance, where she works on a variety of scientific policy initiatives that advance the ecological health mission of the organization. She also co-directs the Blue Ribbon Study Panel on Biodefense, which I believe will be the topic tonight. She's provided consulting services, including writing, editing, and provision of technical expertise in science and policy. She completed a fellowship with the Food and Drug Administration Center for Veterinary Medicine, and she served as a senior professional staff with the U.S. House of Representatives Committee on Homeland Security, working in medical preparedness, biodefense, and science and technology policy. She started that as a AAAS AVMA fellow, so I have another one of those in the room. She also works as a clinical veterinarian in the Washington area and has a Bachelor of Science in Biology from the College of Mount St. Vincent, and received her doctorate in veterinary medicine from Cornell. Welcome.
Thank you. Well, this is quite the group of luminaries, and oh, I need that piece of paper because I have questions that I need to ask this group, and I need to write down the answers because I know I have far more to learn from you than to teach you tonight. So hopefully, though, your trip down here to this lovely new location will be worthwhile. It was the last time I spoke at the One Health Academy was just over 5 years ago, and I can't believe how much this area has changed. This building didn't even exist back then. So really and truly, thank you very much for taking time out of your evening to do this. I know it's late in the day and it's late in the year and everyone's getting into holiday mode. There's not going to be a lot of facts or figures in this presentation. It's really just a chance for me to tell you a little bit about something exciting in my world, which is this new national biodefense strategy that's being developed that I'm really looking forward to seeing.
The microphone's hot if you want to move it.
Okay. This one? I'm kind of more comfortable standing over here. Can they hear me on the webinar?
I think so.
Okay, great. So it's really just a chance for me to tell you a little bit about what's been going on in my world, and I think all of us in this room are really well positioned to provide input into this strategy and the hopeful implementation plan that follows. It's something that could impact everything. All of the work that you do could be either impacted by it or you could impact it. So I hope if you're not aware of this new strategy, I'm able to teach you a little bit about it tonight, and then at the end we can all think about what are the most important One Health principles that we would like to see the White House address in this strategy and emphasize in this strategy. So with that, I thought I would just tell you first a little bit about EcoHealth Alliance, which is where I work now. You heard in my bio, I kind of started my career here in DC on Capitol Hill, so I got quite a bit of congressional experience there. I stayed there for over 5 years, and then in true Washington, D.C. form, I did another fellowship through ORISE with Neil Battaler, and Bernadette was there at the FDA at the time, and Al was there, and we were all hard at work on AMR, which is not what I'm going to talk about tonight, but I have to tell you that the knowledge that I gained from those 9 months or so that I worked on that has followed me, and I've, people often have come to me to ask me for my whatever little expertise I gained from that time, because it's such a hot topic and it's such an important topic, and so grateful for that experience. But since then, I've landed in a wonderful place, EcoHealth Alliance, and I thought I would just share a few slides about EcoHealth if you're not familiar with the organization. EcoHealth really traces its roots back to Gerald Durrell, who was a British naturalist. He was a true lover of wildlife and did an enormous amount of work in the field of wildlife conservation, establishing the Wildlife Preservation Trust, which eventually became the Wildlife Trust, which may be something that you're all familiar with. In 2010, the Wildlife Trust and the Consortium for Conservation Medicine merged and created EcoHealth Alliance. So while you know, we do a lot today that is really at that interface of human and animal and environmental health, our roots are very strongly in wildlife health, which is exciting for me because there was a time way back when that I thought that I wanted to, like many vets, to be a wildlife vet. And while that didn't happen, it's great to call EcoHealth Alliance home now, because ultimately we all work every day in true One Health fashion to advance the health of all species. So as you can see from these bullets here, we have a multidisciplinary crew. We only have about 50 employees. We're based up in New York. Everyone from veterinarians to behavioral anthropologists, economists. There's a lot of modelers. They do really fancy things with numbers and computers that I'm starting to learn the language of that. And we also have a huge network. That's the alliance part of our name. We work in partnership with governments across the world, with policy setting bodies like the OIE and the FAO. So it's a wonderful opportunity for me to learn how that all works, but we're really well positioned, I think, to contribute and to advance both science and policy, that's the interface I like to work at, so I'm very lucky to be there. Just literally, I just wanted to give you 2 or 3 examples of the type of things that we publish. These are not my studies, but these are some studies that have recently been published by EcoHealth employees. And so one of the things that we've worked a lot on is trying to understand where the hotspots of emergence are across the globe. You can find this paper. It came out a month or 2 ago in Nature Communications, and you can see that the global hotspots are kind of where you think that they would be, but there's now an enormous amount of data. There's an enormous evidence base to back that up, and that of course is really important because that's what drives investments. And so you want to be sure that your global health investments are going to where they're most needed. Similarly, my colleague Kevin Olival recently published a paper really looking at trying to understand the host traits and viral traits as spillover predictors. And so they analyzed years and years worth of data, and we're really looking to understand what's the total kind of zoonotic viral richness within different families of mammalian species. And this is a heat map. I'm learning all about heat maps working at EcoHealth Alliance, but you can sort of see the ones clustered over on the left are those families that have the greatest viral richness, and particularly among them are the ones that we work a lot on at EcoHealth: rodents, primates, non-human primates, and bats. And so the idea being that maybe that's viral richness is a predictor of potential spillover. And then this is something, this is an app that our tech team developed. It's called the Flirt database. Flirt stands for something like Flight Information Tracker. And what they're using technology to develop visualizations that allow us to take commercial flight data and use it to try to understand patterns of human travel across the globe, and then to try to assess and predict risk. So this is the sort of thing we use when we're working with Department of Homeland Security, for example, on some of the biosurveillance work we help them with. They're obviously very interested in understanding what airports, for example, might be the greatest risk in terms of introduction of a particular disease from a particular locale. So that's just a little bit of an introduction to EcoHealth Alliance. What I wanted to talk to you about tonight is the National Biodefense Strategy. I'm not really here to talk about the Blue Ribbon Study panel on biodefense, although I will do that for a few slides. But truthfully, EcoHealth Alliance, all of the projects that I work on at EcoHealth Alliance sort of allow me to interface with the drafters of the strategy. I've been fortunate to be invited to provide my opinion on what should be in the strategy, and so I wanted to kind of talk to you really about the strategy, a little bit of the Blue Ribbon Panel's role in it. So, for those of you who may not be familiar, the Blue Ribbon Study Panel on Biodefense it's about a 3-year-old organization, privately funded, and I have some slides coming up where I show you the really wonderful people that sit on this panel that I have the pleasure of supporting. But the first thing that we did after collecting a lot of information was to draft what we eventually started calling a blueprint, and we titled it a National Blueprint for Biodefense. What we were trying to do was to step back and say, we've had over 10 years of investment since the anthrax attacks after 9/11. Where are we still kind of perpetually challenged? What are we still not getting right? What are we underfunding? What are we failing in? And so we came up with a series of findings and recommendations. This report is freely available. It's online. You can look at it at your leisure. But one of the things that we noticed was that there was really no dearth of policy and statute and guidance and treaty with respect to biodefense. It wasn't like it was being completely ignored, but in many ways it was the approach to it had become very scattered, kind of across administrations. You know, you had the Bush administration doing this, and then later on, you know, the Obama administration added some things or maybe ignored some things that it didn't like, and so we ended up with this somewhat kind of fractured policy landscape for biodefense, and that's a little bit dangerous because it's meant to govern a very large enterprise. You know, you have anywhere from 15 to 20 to by some counts even higher than that in terms of the number of departments and agencies that do something, that have some responsibility with respect to this spectrum, all the way from, you know, threat awareness through to recovery and remediation. So you can imagine just pretty much all of the places where you all work tonight in the federal government work on this mission to some degree, and that doesn't even include all of the state and local governments, the private sector that you have to bring in to do things like develop medical countermeasures. So it was this hugely complicated space, and the policy landscape was becoming very complicated, all the while funding in most cases was declining. So we wanted to really step back, and I think this was where my congressional oversight hat came on. I wanted this one-stop shop, you know. I wanted someone to be able to just hand me a document and say, this is the nation's approach to defending against biological threats, whether intentional or accidental or caused by a natural pandemic. So we developed this idea. This was one of the most important recommendations in the report. I know you can't read this, but down here this says, produce the national strategy of the National Biodefense Strategy of the United States of America. So it was just a recommendation at the time. But conveniently, there was a Hill staffer who worked for a member who this piqued their interest, and they decided to introduce it as a provision within the National Defense Authorization Act last year, and it was signed into law. I think it was probably one of the last bills that President Obama signed. In all the years, by the way, that I worked on the Hill, I never once wrote a single word that got passed into law. So it was only years after I left, and that's okay though. I don't mind it. This was really, really exciting for me to see this come to fruition. So these are the folks that carried the message. These are the people that that are the panel members of the Blue Ribbon Study Panel. As you can see, it's very much of the stature of a congressional commission, like the 9/11 Commission, the Graham Talent WMD Commission, and that's what we were trying to do. So it's very bipartisan. We have Joe Lieberman, former senator, and Tom Ridge, former governor of Pennsylvania, and first secretary of Homeland Security, who chair the panel, and they came on board very early. So this panel was the brainchild of a man named Dr. Bob Kadlec, who has spoken here at the One Health Academy. He's now the ASPR, the Assistant Secretary for Preparedness and Response. And Bob can do if he says he's going to do it, it happens. And sure enough, Joe Lieberman and Tom Ridge came on board. And then soon to follow were Donna Shalala, President Clinton's HHS Secretary, and Senator Tom Daschle, former Majority Leader, Jim Greenwood, representative from Pennsylvania, and then Ken Weinstein, who was George Bush's Homeland Security Advisor in his last year in office. So these are the folks who not only do they advise the staff on what they think needs to happen, what's feasible, what should be in our recommendations, but they have the stature to really carry them to the Hill and to the White House and help make them happen. But we also have a panel of technical advisors, and you got to give Bob Kadlec credit. He's an MD, and we've got 3 veterinarians as our ex officio members. So that's Billy Parrish, my current boss, former Wildlife Conservation Society veterinarian. Jerry Parker, whom some of you may know, he's out at Texas A&M now, and George Post, also a vet and a PhD, and he's out at Arizona State. So, and some of these folks have background in law or policy, healthcare policy, you name it. So I've been awfully lucky to work with this panel these last few years. So if this works, this will be a short video clip of Tom Ridge talking about why he felt we needed a national biodefense strategy. We recorded this at the National Press Club earlier this year.
When we talk about biodefense, we're not talking about munitions, we're not talking about soldiers, we're not talking about guns and bombs, we're talking about germs. And so the whole notion of biodefense is how does this country, as it looks at biodefense, let's look at it the same way we look at national defense. What's the threat? Germs. It's a global threat. Zika, Ebola reminds us of that. Is there a way we can detect them, just like we'd like to detect the offensive capability of nation states, as we think in terms of traditional national defense? What are our measures to counter those threats? Well, do we have medical countermeasures to respond to those germs, to the potential pandemic that may come to us from a nation state, may come to us from a terrorist, maybe an accidental discharge from a laboratory, and worst of all, maybe Mother Nature's going to throw it at us. And then if we are able to detect it, then all of a sudden it hits us, how do we respond and recover? So when I think in terms of biodefense, I go all the way from detection and trying to prevent it from happening, to providing those countermeasures to deal with it, to responding and recovery. It's like anything else. It is a real risk. It's a global risk. But it's a risk, I think, that Americans need to, one, accept as a reality. It is a perfect reality, but it's a risk. And with the right kind of biodefense strategy, prioritizing resources, we can manage that risk.
So I don't think Governor Ridge was saying anything there that the folks in this room don't already know, but we've found that these kind of messages, sort of messages to the public, this is up on a YouTube page, putting it in lay terms for the staff on the Hill who maybe don't have that scientific background is really important to get that message across. And when you're Tom Ridge, you get invited to speak on CNN and MSNBC, and so we've had a pretty good amount of success getting people to listen. And there's all sorts of like new, you know, biodefense programs popping up at different think tanks around DC. So I think it's all to the good. And so this is the end result of all of that work. This is the bill language right here, and it really just does a great job describing what we called for in the Blue Ribbon Report. And I know sometimes, not anyone in this room, sometimes people in the executive branch ignore what's in the law, but the White House is actually doing this. And what was required by the law was that 4 departments come together, DHS, HHS, USDA, and DOD. This was the NDAA after all, so DOD is mentioned first and foremost. The only thing that kind of disappointed me a little was that, of course, we all know that this effort takes a lot more than those 4 agencies. I mean, certainly they probably have the lion's share of the budget, and optically it's great, right? Because you've got a human health agency and an animal health agency, and 2 Homeland and National Security agencies on board. But the exciting thing is that the White House actually understands that more multidisciplinary approach is required, and they actually have 16 different agencies seated at the table right now in drafting this strategy. So I have no idea what's in it. I hope that doesn't disappoint you. I get asked to speak on the National Biodefense Strategy a lot, which is funny because I literally have no idea what's in it. If anyone here knows what's in this strategy, like maybe David, for example, has been invited. No?
I don't know anything about it, but I'm interested in it, so I want to hear what you say.
Okay, good. Okay. Anyone? Neil? No? No takers. Okay. I was just hoping for a little bit of intelligence.
One Health anywhere in the strategy?
Well, I haven't seen it, but rumor has it that the words One Health actually do appear in the strategy multiple times. Yes, yes. Not just like animal or environment, but I'm pretty sure One Health is in there as a concept. So these are what few facts I have about this strategy. 16 departments and agencies at the table, which of course includes the 4 that are in the law, but I think there are others like, well, CDC and NIH probably have their own seats at the table separate from HHS headquarters, I would think. I would think EPA is in there. I'd be shocked if VA wasn't part of this. And when you think about the list, I mean, the U.S. Post Office does scanning of mail for biological agents. The FBI has got to have a seat at this table. So I'm hopeful it's going to be comprehensive. I think that there are 6 goals, from what I understand, and the first major goal is to create a coordinated biodefense enterprise across the federal government. And then the others sort of, I think, follow along the general lines of threat awareness, preparedness, response, recovery. So probably no big surprises there, but the devil will be in the details of the objectives and the sub-objectives. Rear Admiral Tim Ziemer is the Senior Director for Global Health and Biothreats at the White House now. He's well known for implementing PMI, the President's Malaria Initiative, and although he doesn't, do you know, I don't think he's an MPH guy, I don't think he's got a science background, but he really took to public health from the policy level and the political level, and he's known for making things happen, and he told the panel that they're really working on this in a systematic way with lots of objectives and sub-objectives, which I think are all meant to be mapped to outcomes, very specific outcomes. So I think that what I heard was that there were a lot of fights about how you define biodefense, which you can imagine could be tricky. You know, for a long time, the word really referred to terrorism-inspired events, but it's sort of come to be viewed more broadly than that, and we do know that that's how they're looking at it in the strategy. So this will be a pretty comprehensive strategy that includes, you know, everything from intelligence collection, you know, within the intelligence community, looking at state actors and non-state actors, and right up through to the next Ebola outbreak. So, oh, and Tim Ziemer did mention that part of the reason it's delayed, it was supposed to be out in September, now it's looking like January, is because they're trying to draft it in some kind of alignment with the national security strategy, which it certainly sounds like a good thing to me. So, I gave a little thought to what I would like to see in the National Biodefense Strategy, that in the context of One Health. There's obviously a lot of other things that need to go in there, but I would love for you all to interrupt me and to add your own things to this list. But the basic buckets that I was thinking were in terms of, you know, your major groups of animals, livestock, companion, and wildlife. I think they all do need to be addressed. If not in the strategy, which will be at the higher level, then definitely in the implementation plan, which the law also requires. I'd like to really see a commitment to global health security. Admiral Ziemer has said that the Trump administration is committed to global health, and they understand that there are really, you know, no borders in that sense between domestic health and global health. So I'm hopeful that that's reflected here. And then aligning it with money. I mean, the piece of paper isn't going to mean anything at the end of the day if there's not a plan to fund it. And so we would hope that once they have this strategy in place, the budget requests that come out of OMB follow. You know, this February's budget request is probably out of sync with the strategy, but hopefully by next year we start to see prioritization. You know, Admiral Ziemer has said it's going to be a big strategy and an even bigger implementation plan. We're not going to be able to do everything all at once, so we're going to have to prioritize. So start thinking about what your priorities would be. I have a few slides on each of those, but I wanted to bring this to your attention. During the development process, Johns Hopkins University convened a stakeholder session. It was like a listening session, really, where one representative from each department came and they sat and they listened. And there was a room full of like 50 people from 50 different sectors, including plant health and animal health and pharma. And this was one of the findings in the paper. And I was sitting there and I heard this, and I thought it was really encouraging and really important for the federal employees who are writing this strategy to hear this. We need stronger links between, this was in the biosurveillance section specifically, systems to capture data on human, animal, and plant health. We need stronger investment in human, animal, and plant laboratory networks. We need improved reporting from industry, from producers in the animal and plant world. So I have good reason to believe that they're getting the One Health message. Okay, so my first point on livestock. Yesterday, the Senate Agriculture Committee held a hearing on Agro Defense. This committee is chaired by Senator Roberts of Kansas. Steve, what are they building in Kansas? The NBAF. And Debbie Stabenow from Michigan. They haven't held a hearing on agro defense or agro security in a decade, according to the chairman's opening remarks. So, but they're drafting the Farm Bill right now. The Farm Bill comes along every 5 years, and it's always, you know, a great opportunity to get parochial interests in there, of course, but also the bigger strategic interests. And the Blue Ribbon Panel just released a report on Agro Defense where we did kind of a deeper dive into the particular issues within that sector. And so you can see Senator Lieberman there on the left testifying. Next to him is General Richard Myers. He's the former chairman of the Joint Chiefs. He's now the president of Kansas State University, where they're building the NDAP, right. Next to him is Dr. Hammerschmidt, a plant scientist from Michigan State. And who knows the guy on the right? Doug Meckes, yeah. Doug Meckes, formerly of DHS, now state veterinarian from North Carolina. And they all basically said the same thing. We're not prepared. Like, if there's a bad outbreak, we're kind of up the creek. So here are the things that we need to do. And everyone was kind of singing the same tune. These were sort of the major findings from our report that Senator Lieberman talked about. You know, somebody needs to take leadership and ownership over this issue, and we're not quite seeing it. If anything, the DHS budget with respect to this particular issue is shrinking, and it's not like it's being given to the USDA. So that's concerning, and whatever your feelings may be about the NBAF, the fact is they spent over $1 billion constructing it, and if they don't fund operations, it's just going to be an empty lab. And there's precedent for this because the president's budget just eliminated a huge and brand new laboratory, Biodefense laboratory in Maryland up at Fort Detrick. It's called the NBAC. It was only established in 2010, and the president's budget zeroed it out. So I think the folks out at Kansas State are a little bit nervous that that could happen to them as well if there's not a business plan, a business model, something to sustain the research that could be going on there. We need to see something about the National Veterinary Stockpile addressed in this strategy. Everyone knows that that stockpile has very little in it. To the extent that it is populated with inventory, there's not a lot of medical countermeasures in there, and it gets $4 million a year. So we're not where we need to be. There's a huge discrepancy, of course, between the Strategic National Stockpile and the National Veterinary Stockpile. And I'm not saying that they should be on par with one another. We don't need absolute parity, but the NVS is all but forgotten by the administration and Congress, and that needs to change. I don't want to talk too much longer on this, but we have more recommendations on biosurveillance and law enforcement coordination in the report as well. Okay, who's that? Nina Pham, who you probably met.
I did not.
You did not. Do you know the name of her dog?
No.
He's very appropriately named. His name is Bentley, and his quarantine cost $27,000. So Bentley was quarantined.
About one wheel on a Bentley.
Right, maybe just one wheel on a Bentley, not a whole Bentley. That's probably true. So I think we are absolutely unprepared to deal with this issue. Fortunately, Bentley never had Ebola. He never tested positive for Ebola. But let's just look at the what if. Like, what if he had? What if dogs could have been carriers for this disease? We had absolutely no guidance of any kind to deal with it. I mean, it was hard enough, really, getting the right guidance to hospitals to deal with human patients on PPE. There's really nothing in our arsenal with respect to companion animals and zoonotic diseases. And that needs to change. So these kittens are just a reminder. It was from an article about a year ago when a strain of avian influenza broke out in cats in the New York City animal shelter. And that flu strain did transmit to one of the veterinarians at the shelter. Did not become a pandemic. She did not get very sick. But again, it's the what if. And I don't think it's about fear mongering. I've been around long enough to know that so much of what we do, and Congress, frankly, in particular, is reactive. I just want to see some proactivity. And so these are just a couple of the things that I would love to see the strategy address. Guidance for companion animal zoonoses. Guidance for dealing with contaminated animals. You know, animals can get contaminated with radiation, with chemical weapons as well. It's hard enough for us to handle that with humans. We're still not quite there in terms of guidance for animals. Ty Vanhoeven, did I pronounce that correctly? He's worked a lot on this issue of sort of the interface with respect to guidance, and I think he was able to get a lot more in the last iteration of the biological incident annex. And so I think we're a lot farther along than we were before, but nowhere near where we need to be. So I think the National Biosurveillance Strategy could really be a driver of this issue. Here's why I think this is never going to happen. Because nobody wants to talk about pet euthanasia, right? It's like this huge third rail. No one wants to talk about pet quarantine. No one knows where on earth the money would come from. I mean, Bentley's quarantine, from what I understand, was covered through philanthropic donations. It wasn't like it was covered by the government. So I don't really know if this is going to happen, but I think if I were a state or local government, I would really appreciate something, you know, from the CDC. It probably is the most likely agency for this, just to help me at least start thinking about what these scenarios of zoonoses could look like. I'm going to end soon, so I won't get too much into wildlife, but I think there's a lot more that we can do with respect to thinking about biosurveillance of wildlife at that interface with livestock or with other animals. You know, the National Wildlife Disease Program at USDA, I think, gets basically $3 million a year worth of operational funds. It's not a lot of money. And then this is just, you know, my push for an emphasis on prevention. I'm working on a project now where I'm looking at global health security, and we're trying to assess gaps, not in the way that like the JEEs, the Joint External Evaluations, go country to country and assess gaps, but to step back even farther and look at what the global initiatives are that are trying to plug holes. So for example, you have like CEPI, which is trying to work on, you know, the medical countermeasure piece. And so we're sort of taking stock of what all those global initiatives are and figuring out what are we still not paying attention to. And it's way too soon, like I don't really have results yet, but we certainly hypothesize that there's, you know, far greater investment and emphasis on response than there is on prevention. I mean, this is anecdotally, this definitely seems true to me. So, and maybe you all have a perspective on that. But we tend to be a reactionary kind of society and government, and maybe there's just an element of humanness about that. But we could change that if we wanted to, and we'd save a lot more lives, and frankly, we'd save a lot more money in the long run because the cost of responding to outbreaks is becoming utterly unsustainable. Global health security, like I said before, I hope very much to see this emphasized in the strategy. And you know, I was thinking as I wrote this that maybe part of the problem with global health security is that it gets its own separate funding lines, right? And so it's viewed as somehow separate from our own domestic health security. But of course, we all know that it's all one and the same. And so it segues into my last point about the budget. We're going to release a report in January or February that proposes kind of a new paradigm for budgeting for biodefense, one that would require OMB to submit an integrated biodefense budget. Not a truly unified separate budget. You know, the closest thing we probably have to that in the federal government is the intelligence budget, which is kind of administered by the DNI, the Director of National Intelligence. But just let all the let FDA have their piece and NIH have their piece just like they normally do. But there needs to be a more systematic process while they're all developing their budget requests that are, you know, should be designed to be meeting goals of the National Biodefense Strategy. And then they're creating those budget requests in context. And then OMB submits this to the Hill. And yeah, they submit the NIH budget and they submit the CDC budget and the DHS budget. But then they also submit this report that puts them all together so that the appropriators and the authorizers can see it as a unit and can make decisions about it in context of the whole. The departments or agencies are going to hate this. They're going to hate me, and that's okay. I stand by this as I think a good government idea. So we'll see if it ever comes to fruition. I hope that it does. And lastly, just thanks. These are all the folks. First, thanks to Will and the One Health Academy for inviting me here, and these other really smart people who I've talked with recently who infuse their intelligence into my brain, and then I can bring that to you. So that's really all my prepared remarks. I'd love to know if you have any questions, or if you disagree with any of this, or if you have thoughts about what you want to see in the National Biodefense Strategy. The strategy will be out soon. We don't have too much more chance to influence it, but the implementation plan, I suspect, will take a while, probably the better part of the coming year to write. So we need to do our duty and try to advocate for One Health to be in it. Sure.